If you've ever tried to understand U.S. health insurance and felt confused, embarrassed, or even scared, you're not alone. Every immigrant I've ever met has said the same thing. This system feels like a puzzle, and I don't even know where to start. And the truth is, it's not your fault. The U.S. health system wasn't designed to be simple. It wasn't designed to be friendly, and it definitely wasn't designed with immigrants in mind. But today, we're going to break it down piece by piece so you can protect your money, your health, and your future. Because once you understand how this system works, you take back control. Most of us come from countries where healthcare is straightforward. You get sick, you see a doctor, you pay a fee. Simple. But in America, you're hit with a whole new language. Deductible, coinsurance, out-of-pocket maximum, in-network, EPO, PPO, HMO. It's not just English, it's a completely different world. And here's the part nobody tells you. Even Americans who were born here struggle with this system. So imagine how immigrants feel, learning the language, the culture, the laws, and then being expected to understand a system that confuses everyone. But the stakes are higher for us. One mistake, one wrong hospital, one out-of-network doctor, and you can end up with a bill that destroys your savings. That's why we're doing this, to protect you from the traps that catch millions of people every year. Let's break down the words that confuse everyone. Once you understand these, everything becomes clearer. Deductible. This is the amount you must pay first before your insurance starts helping. If your deductible is $2,000, you pay the first $2,000 of your medical costs every year. Copay versus coinsurance. A copay is a fixed amount, like $20 for a doctor visit. Coinsurance is a percentage, like paying 20% of the bill while insurance pays 80%. These two numbers decide how much money leaves your pocket every time you get care. Out-of-pocket maximum. This is the most you will pay in a year. Once you hit this number, insurance covers 100% of covered services. This number can save your life financially, but only if you know it. Networks. In-network means the doctor has a contract with your insurance. It's cheaper. Out-of-network means no contract. It's expensive, sometimes 5 to 10 times more. This is where most surprise bills come from. Now let's talk about choosing a plan. There are 4 main types. HMO, cheapest monthly cost, but you must stay in network and need referrals. PPO, more expensive but gives you more freedom. EPO, like an HMO but without referrals. POS, a mix of HMO and PPO. Where do these plans come from? Employer plans, usually the best value. The healthcare.gov marketplace, for people without employer coverage. Medicaid and CHIP, for low-income families and children. Before choosing a plan, ask yourself, how often do I see a doctor? Do I have chronic conditions? Can I afford a high deductible? Do I need flexibility or lower monthly payments? Your answers guide you toward the right plan. I know this is a lot, and many of us feel ashamed asking questions because we don't want to look like we don't understand. But this system confuses everyone. You are not alone, and you deserve to understand how to protect yourself. Let's go deeper. These are the traps that catch millions of people every year. Once you understand them, you'll avoid most of the problems people face in the U.S. health system. The surprise bill trap. You go to a hospital that's in-network. You think you're safe, but the doctor who treated you was out of network. Same building, same hospital, different billing. And suddenly, you get a bill for $1,500, $3,000, sometimes more. So here's the rule that protects you. Always ask, is everyone treating me in-network? The doctor, the lab, the anesthesiologist, the radiologist? One out-of-network provider can ruin you financially. Next trap, ignoring your EOB. Your EOB, your explanation of benefits, is not a bill. It's a receipt that shows what the doctor charged, what insurance paid, what you owe, and whether something looks wrong. Mistakes happen all the time. People get charged for services they never received. People get billed twice. People get charged out-of-network prices for in-network visits. Your EOB is your shield. Use it. Another trap: letting your coverage lapse. You miss a payment. You forget to renew. You lose your job and don't replace your insurance. And suddenly, you're uninsured. Then something happens: an accident, an illness, a simple emergency, and the bill destroys your savings. In America, continuous coverage is protection. Even a short gap can lead to higher premiums, denied claims, massive medical debt, and losing access to your doctors. If you lose coverage, act fast. Marketplace plans, Medicaid, and short-term options exist to protect you. Wealth begins with health, so do not skip your doctor's appointments. Taking care of yourself is the first investment you make in your family's future. Let me give you a few real situations immigrants face. A father took his child to the ER for a fever. The hospital was in-network, but the pediatric specialist wasn't. The bill was over $2,800. A woman went for a routine blood test. The doctor was in-network, but the lab wasn't. She owed $600 for a test that should have cost $40. A man ignored his EOB for months. When he finally checked, he realized he was charged for a procedure he never had. He fought it, and the bill disappeared. These stories are common, and they happen because people don't understand the system. But after today, you will. Here's what you can do right now to protect yourself. Use healthcare.gov. It's the official government website. You can compare plans, check prices, and see if you qualify for discounts. Find a community health center. These clinics offer low-cost care, even without insurance. Ask for help. Navigators and brokers can guide you for free. Review your plan every year. Your needs change. Prices change. Coverage changes. Keep every document: bills, EOBs, letters. They protect you if something goes wrong. I know this system is confusing. I know it feels overwhelming. And I know many immigrants feel embarrassed asking questions. But listen, you deserve to understand your health care. You deserve protection. You deserve clarity. And you deserve a system that doesn't punish you for not knowing the rules. On Immigrant Money TV, we break things down so you can build a safer, stronger future in America, one decision at a time. If this helped you, share it with someone who needs it. You might save them from a bill they can't afford. Welcome to Immigrant Money TV, where we learn, grow, and protect each other.